Bert, how are you?
I'm very good, thank you.
Very good, very good. Thank you for joining me today on the couch with Liam the Mole for Movember.
Is he growing well?
Oh, he's growing very slowly, as you can see, but hopefully we'll get there by the middle of the month. Thank you for joining me here today. As we all know, this week I'm focusing on prostate cancer for guys. It's a very important message for men out there to take care of their health, and this is the primary message for Movember. So I just want to ask you a few questions. Do you think addressing men's health is important, and why?
Probably from personal reasons that I ignored my health to a certain extent, and I had one experience with it that wasn't very pleasant.
Yeah, okay. Do you want to tell us a little bit more about that?
Why it was unpleasant?
Yeah.
Pardon me, the reason it was so unpleasant is the fact that I ignored it.
Yeah, okay.
And I think most of my cohorts and peers and men ignore it exactly the same as I did.
Okay. So definitely there needs to be greater awareness out in the community for people to talk more about it and make it more of a conversation piece. Yeah?
That's going to be very difficult.
It is.
Because most men ignore their health at their own detriment.
Yeah. Why do you think that's the case?
The attitude that they're supermen.
Are you a Superman, Bert?
No, I'm not a Superman. But we think we're invincible, and the fact that we're men, we don't need to show any weakness and that sort of thing. Going to the doctors is a weakness.
Yeah, that's
a perceived weakness.
That's right. That's really unfortunate, because at the end of the day, we need to empower ourselves to go and see the doctor when we're not feeling well, and get it addressed as quickly as possible. So what can we do as a community in addressing men's health, do you think?
Probably what you're doing now in advertising more, but it's going to be very difficult because of men's attitude towards themselves and seeing doctors and that sort of thing. The attitude would be the biggest thing to overcome. Absolutely.
Do you think there's a difference in attitudes between generations right now?
Probably my generation was definitely anti-doctor. They may be improving now, I don't really know, but for their own benefit they should be.
Okay. I think absolutely you need to have that consciousness to be aware and to encourage all your buddies, and your mates, to take proactive action, so that we can get the conversation going.
Perhaps we should make it a topic of every public discussion that they have.
Oh, absolutely. I think you have a
take it into the
men's health forum and talk. Yeah, that's right, absolutely. So the next question I have here for you is, as I said earlier, this week as part of Movember, Liam the Mole and I are raising awareness around prostate cancer. Do you have any personal experience or know of anyone who has been affected by prostate cancer, and can you tell us about it?
My experience was a little bit different to that with prostate anyway. I had a few early digital examinations by a doctor, but I disliked them intensely, and I avoided them with great awareness. I wouldn't go to the doctors even though I felt ill with flu or anything like that. I knew it would be ultimately one of the things that he would do, so I avoided going to the doctors and did it for years. As a result of that, I didn't realise that my prostate was actually enlarging. It enlarged to the extent that I could not pass urine. It was painful. I spent months and months with pain, trying to pass and that sort of thing. And eventually finished up in emergency hospital. Where they give me some relief for that sort of thing. The result of that was that I had a reduction. And the reduction fixed things up to an extent that I was back to normal. Or what I thought was normal. My doctor still insisted on digital examination, which I wasn't very keen on, but I let him do them because of the previous experience, whether it was enlarging or not. At one of his examinations he found lumps on my prostate. And that was quite alarming. I followed through with that. He had them biopsied, and actually they were benign, which was a great relief to me. Since then I have regular digital examinations, and I don't care. I am embarrassed about my doctor doing it, but the thing about it, he says to me that there's more bacteria in your mouth than in your bum, so
That's good. That's good to know. You feel much better, actually, don't you?
I feel much better than that. But basically, no, I would still have my digital examinations and look part of that.
Yeah.
It was a part of me that I thought would never happen because I never ever thought of prostate.
Well, it's almost like a barrier, isn't it? A mental barrier, to go for a digital examination, and it can be quite embarrassing. But what you said is quite important, is that to place the trust in a doctor and for the doctor to know what they're doing and to know that it will be over in less than a minute, really, with the examination. And you do have that peace of mind anyway after that.
It is the simplest and easiest examination you have at a doctor's. It's over in about 10 seconds. And you get a result, good, bad or indifferent.
That's right. So if you have an opportunity now to address all the guys watching this video, what would you tell them?
Don't worry about a digital examination. It might be slightly embarrassing, which it is really embarrassing for that to be done. But do it because for the benefit of your own health and the well-being. I would never want to go through the pain that I was having before I had the reduction. And the relief I had when I found out I was benign was brilliant. Okay. So that was me over and done with.
Thank you very much for sharing this with us. It's important to put a face to a story, and I think, for people to actually understand what the message is all about and to hear a story from someone who has gone through something similar. Luckily yours hasn't turned out to be much worse, that it could be a malignant tumor, so and I think that's why a lot of guys really need to take that first step and get themselves tested. Even with a blood test, you started with a PSA test, and then they proceed with the digital examination to confirm. So it's actually quite easy nowadays for guys to detect potential prostate cancer at a very early stage.
One of the mottos could be, don't have the fear of the finger.
Well, that's right. The fear of the middle finger. Okay, well, this brings us to the end of this session on the Couch with Liam DeMo. Remember, with your support and donation, you can absolutely make a major difference in men's health and well-being. So if you haven't donated yet, please go to mobro.co/SimonHM and make a donation so that we can really invest in men's health for the future. See you next week.